Welcome back to Cureus Conversations. My name is Shreya, and today we have the eminent Dr. Khalid Bhatti with us today. How are you doing today?
Thank you, Shreya. I'm pretty good. Thank you very much for inviting me and asking me for talking about the paper.
Of course. So the paper we're discussing today is going to be diagnostic performance of artificial intelligence-based models for the detection of early esophageal cancers in Barrett's esophagus, a meta-analysis of patient-based studies. But before we get into this paper, can you tell us a little bit about your background and your professional pathway?
Yeah, Shreya. So actually, I was trained back home in Pakistan as a general surgeon in 2010. Afterwards, I moved to Oman. I served there for like 5, 6 years. Then I wanted to further my career in gastric in the cancer surgery. So I moved to UK and in 2017. Since then, I am in training program. I'm heading towards the CCT in esophageal-gastric cancer surgery.
Fantastic. So, what initially drew you to the subject of esophageal cancer treatment, and what sparked your interest in the applications of AI to cancer diagnosis?
I think the problem with the esophageal cancer is that it has very bad prognosis if it is advanced. And that's why there are screening programs in place, especially in Barrett's esophagus. We know this is the one of the pre-malignant condition. That's why we do screen them. The problem with these conventional methods are that the still miss rate is quite high. About 20-30% of the cases they are missed by the conventional methods. So artificial intelligence, you know that it can analyze a huge amount of data, um, which the human can't. So I thought there is definitely a potential in this regard that the artificial intelligence can help us in reducing the missed diagnosis so that we can pick up these cases early. And the cancer treatment for these patients are different. If they are picked up earlier, we can do organ preservation. They don't need esophagectomy. So this was the aim behind this research paper.
Fantastic. And pivoting towards AI a little bit, why is it important to examine the potential benefits and drawbacks of utilizing AI in cancer care specifically?
I think it's a big stake, to be honest, because if we don't critically evaluate any evidence, then we can make the wrong decisions. So if we don't know what are the benefits and what are the drawbacks, we may harm the patients. So it's always important that whenever you get any paper, any research, you should critically evaluate it. So AI has a lot of potential, but if the CNN or the neural networks they are not validated properly, can come across a wrong conclusion and it can harm the patient. So that's the reason behind that.
Wonderful. And so now could you walk us through your paper a little bit?
Yeah, we can see the idea actually in 2021 when we were thinking that how can we reduce the negative or the misdiagnosis rate. So after conceiving the idea, first we wanted to evaluate the evidence available is so far. Then we got it registered with Prospero, which is one of the institutions where you get your meta-analysis and all the systematic reviews registered. Then we were two actually independent authors. We searched the literature, found search all the engines. We came across a lot of studies, and then we found we wanted to focus only on the patient-based studies. We didn't want to do in laboratory sort of thing, just training the model with the pictures and photographs, and then coming across the sensitivity and specificity. We wanted to see what is the real performance of these softwares are. So we included only 4 studies. There are a huge number of patients in those studies, but ultimately we come across that the pooled sensitivity is about 0.90, which is like 90% of the cases can be picked up. Still, there's a misdiagnosis rate of 10%, but I would say that this is much better than having the misdiagnosis rate of 20 to 30%. The specificity is still an issue because you have 86% specificity, which means there will be overdiagnosis in a lot of patients, and it can cause some sort of in all the screening programs you have this issue that the people can have a psychological impacts because of the false diagnosis. So we have picked up that there are a lot of a lot of potential in AI, but it requires a lot of work to be done.
Fantastic. And so what do you see as the implications of the study into the applications of AI into cancer treatment?
I think the implications are that we can, for the time being, we can't use it as an automated model. We can't. The reason is that there are certain standards to MET. First of all, the sensitivity maybe is 90% is okay, but there is a positive predictive value of 98%, which is required before anything can be automated as per the American guidelines. So this is one implication that this is not still ready. The other implications are that we have identified a lot of gaps in the research. We found that the reporting systems, they are not standardized. The photographs, they are used to train the models, they are not standardized. Then there is a huge gap or potential in making the collaborative banks for these images. And once you have trained them, then they should be really tested in the human beings and then see what the results are. So I would say that this research actually inspires the people to do more research in this area.
Fantastic. And I'm sure it's a very inspiring and timely application, especially given like the current move towards AI in like all different fields right now. So it's only telling that it'll be a shift in medicine as well. So
I can't,
fantastic.
I can't agree more than this. Yeah.
Yeah. So what work do you have planned for the future then?
Well, we're looking into the other domains. So we are talking about the diagnostic accuracy here in this paper. But if the patients have been referred for the esophageal cancer and they are being discussed in MDT, so is there any role of AI or ChatGPT even in helping these decisions? And if the decisions have been made, can they help in segregating those patients into different treatment groups while they are going to a palliative or curative pathways? Then we have a potential to predict the morbidity and mortality in these cases. And my dream is that actually, as an esophageal gastric surgeon, people should have an Alexa-like device. I have named it as an AXA, which is like an esophageal cancer surgery assistant. So we know that all the risk models we have, they are generic. They are not based on the particular patient. But if you have a data which is like a preoperative, perioperative, intraoperative data, even the postoperative data, if you put that into one of these engines, and then you have a local, application or the local system available where a surgeon-specific complications and surgeon-specific morbidities and outcomes are available. So you can have a surgical assistant which will help you in actually telling you that last time you did this thing and these were the outcomes, and this time you have to do slightly different. So these things, I don't think these are far off. I think they are on the way.
Wonderful. And that will surely shape the way we think about medicine as well as we treat patients in the future. So let's pivot a little bit to some more personal questions. Just as like kind of a fun question, what's your favorite paper that you've written so far?
I would say I haven't published. I've written it. I haven't published it yet. I have a great interest in medical education and especially in surgical simulation. So what happened in 2019, we got into training and then we came to know that COVID is around. There are a lot of challenges. You don't have a lot of lists available for theater. You don't have courses available. So this was a huge issue. Even the booked cases, the booked courses, they were canceled. So we came across an idea that I think what are the resources at hand, we need to utilize them. So I developed a model for the simulation myself from the things available from home, and then started practicing on that. Got a lot of rewards in terms of presenting in different forums, getting prizes for the innovation, and then I have named this paper as like Necessity, the Mother of Innovations, a surgical trainee's chronicle. So the idea is to go through my experience and tell what happened and how I utilize these opportunities, how they have benefited me. So hopefully this will be out soon, and then that will be my favorite paper.
Yeah, that sounds so interesting. Did you use like a virtual reality based framework for this?
Because all of these publications, they have been out before these frameworks available. So I
Oh,
haven't used them. So I want to try them actually. I think it has got a lot of potential, but the problem would be the ethical issues associated with them. That you claim that this is your personal piece of work, but you are getting help / you are creating with the help of certain AI language models. So I think we really need to make certain rules or standards for these sort of things.
Yeah, that sounds very promising and very, very interesting. I'll be sure to read that when it comes out. All
Thank
right.
you.
Well, thank you so much for joining us today on Curious Conversations.
No problem. Thank you.